This APPA research project explored the role of employers and systems in enhancing the health and well-being of principals and associate principals. It builds on the work of Dr. Phil Riley and others. The research aimed to identify the current range of supportive policies and practices, propose recommendations for enhancing those policies and practices, and for development of additional strategies and actions. The survey and report strengthens the advocacy of APPA and state and territory principal associations for those employer and systemic policies and practices that are seen to improve and support health and well-being. First things first, who did we talk to? The research received 929 respondents from across the country. 7% surveyed were from a remote area. Importantly, it was broadly representative.
Living in a remote area, we don't receive any additional funding for travel to courses and accommodation.
%45 were within the 51 to 60 age bracket, followed by 40% between 36 and 50 years old. 70% of respondents were in non-teaching principal positions. The majority surveyed were from government schools, but again, the spread was broadly representative of the three sectors. The largest group of respondents cited having between 301 and 500 enrolments in their school and growing. Most of the people who responded have been a principal for between 11 and 20 years.
It isn't about the years in the job, but feeling that you can make a difference.
The vast majority agreed that they felt able to work with the employer and systemic policies. 96% said employer and government accountability requirements are an increasing proportion of their workload.
The role of principal has greatly moved away from leadership in the management of children, staff and community to accountability-based forms and ticking boxes.
Most respondents agree that the staff and community in their schools support the policies in place at their schools.
I absolutely love the part of my job that involves students, parents, teachers, office staff and aides. To work with my leadership team and other staff members is an absolute joy.
Respondents were asked to what degree the support available to them allows them to manage students, staff, and parents. Overall, principals surveyed said they had a below-average feeling of health and well-being, which they predicted would continue to decline over the next 5 years.
I'm currently considering my future in this role. For the first time ever, I'm seriously considering walking away.
When asked what changes respondents would make to the role of principal, the question drew 664 comments, 30% of which mentioned the need to decrease the amount of red tape and paperwork. Over recent years, primary schools have been affected by, for example, societal change and family pressures, technological advancement and the growth of social media, increased attention on education with raised parental expectations, and the focus on national and international student achievement comparisons. Schools have to keep up with a growing knowledge of how the brain works and how children learn. In addition, there has been the introduction of a national curriculum, the teacher and principal professional standards, increased professional development requirements, national testing, and more in the way of compliance and accountability measures.
This role would kill me if I let it.
APPA's Policy to Practice survey is a wake-up call. Principals need to devote energy to keeping physically, mentally, and emotionally well. However, what's clear is that the expectations placed on schools together with demanding accountability and compliance measures, have increased hugely. Additionally, parental aspirations have never been higher at a time of a global uncertainty, economic concerns, and high youth joblessness in Australia. In amongst this, we know that primary schools are complex organisations with limited available resources. They need solid support and good structures, as well as the time and resources in place to support our primary school principals in leading their schools. Good schools are
characterised by dedicated school leaders and teachers with high expectations of student learning and communities that respect and value education.
Principals must be able to rely upon clear, practical, and well-targeted employer system and government policy and practice. Principals in a supportive policy environment report better health than those in schools who don't receive that support.
A lack of trust and support makes dealing with the complex issues of leading schools very isolating, adding significantly to stress levels and having a negative impact on the health and well-being of principals. Principals are struggling in the role and leaving in increasing numbers.
It does not need to be so. Systemic and employer trust and support is not too much for any professional, paraprofessional, or volunteer working in primary schools to expect. Principals stand ready to play their part in making trust and support the new reality.